Hi guys, good afternoon once again. As we were discussing that there are five things we should notice: grammar, active passive, adverbs, articles, preposition and adverbs. Now we will take live examples of how to notice these things, and these are very important. I will tell you now. So I'm doing one or two questions for you. First of all, I'm just starting to do this part B question. If you all can see, first question. According to the passage, a phrases is currently being used often in. This is also a passive voice जो हम notice नहीं करते हैं. Is plus third form. And being का मतलब है present continuous. That means it is currently being used. That is a present continuous tense. So we should know how to track the passive voices. Now the question again is, according to passage, this particular word is currently being used often. Often means most of the times. It is an adverb. That is why I was saying, see, this single question after doing that discussion ki grammar, adverbs, it is so important because ये hint होता है. Sometimes the language is very easy, तो often word की जरूरत नहीं पड़ती. But sometimes language in the paragraph is difficult, तो often word आपको help करता है ये समझने में कि ये कहाँ पे दिया है. जैसे अब मैं इसके पैराग्राफ पे जाता हूँ. ओके, ए फेरेसिस. अब हमें क्वेश्चन हमेशा याद रखना है. हमने क्वेश्चन पढ़ा है, क्वेश्चन के बाद पैराग्राफ. क्वेश्चन हमें हमेशा रखना है. क्वेश्चन था इट इज करंटली बीइंग यूज्ड, प्रेजेंट कंटीन्यूअस. ओके. Apheresis is an external therapy in which blood is removed from the circulation. Blood is separated into components. One or more component is removed and a blood is returned to the patient. ये लाइन मैंने जल्दी इसलिए पढ़ी आपको बताने के लिए कि इन एग्जाम ऑल्सो यू हैव टू बी फास्ट इन दिस लाइन. डोंट वेस्ट टाइम. रिमेंबर योर क्वेश्चन. ट्राई टू ट्रैक योर लाइन. सबसे पहले स्कीमिंग और स्कैनिंग करके उस लाइन पे पहुंचना है जहां पे हमारा आंसर है. सो अगेन आई एम फास्टिंग अप द पेस of the extracorporeal therapy. Apheresis is the newest form being used more commonly. There is the often word commonly. More commonly means often. That is why I was telling you you should know how to trace grammar, active passive, adverbs. Now I can trace being, hint, used, passive voice, इसके साथ used, so I can see passive voice relation, and also I can see ly word relation. In a way often means more commonly, so that means my answer should be in this line. Of the extracorporeal therapies, newest form being used in veterinary patients. If I go to question again, even there should be a hint of newest word as well. Currently means it's kind of newest word. So this is how the words are correlated with each other. So I'm just taking the help of thanks for creating the question paper English things. But yeah, I'm just trying to tell you how to do these questions. So now what it does, it saves all the time of the world. Now I know my answer should be veterinary patients. So apheresis is being commonly used in veterinary patients. So I will simply go to options: curing cancer, treating animals, extracting. I know veterinary is treating animals, so B becomes my answer. So that is how important is to notice passive voice, adverbs, newly, currently, often. This is one single example in which everything is being covered. In final exam, you might get only one word that will give you hint that answer is in this line. So the first answer becomes B without any pay. Let's do one more question, that is second question. Second question is a little different question because second question is the question of chief aim, chief objective. These questions I always say the most probably these answers are in the last line. Last line means if you read the whole paragraph, in the last line they will conclude the paragraph. So that is how we can maybe understand the chief objective of this thing. Chief objective means what is the main aim? What is the purpose of this paragraph? Questions like aim, purpose, objective. Objective means what is the aim. And in this question, chief word is also very important. Chief means what is the main aim. Okay, let's read. So chief is also a very important word. Let's read the paragraph. Email to all staff, medication errors. First of all, subject is a very important thing in these questions. So chief objective of this email is that we have to give information about the medication errors to the staff. Now I can understand the topic. The chief aim of this mail is to give the information to staff. About what? About the medication errors. Once topic is clear in my head, it becomes easier. Now let's do it. Collaboration between all the members of the healthcare team responsible for medication delivery is needed. Again, once you will start noticing the passive voice, you will understand the importance. Healthcare team responsible for the medication therapy is needed to create strategies. So basically healthcare team जो responsible है medication therapy की is needed. So what is needed? Healthcare team is needed. Passive voice है, that means we require healthcare team that will prevent the medication errors. So basically this email is for the whole staff, that how can we prevent the medication errors. Registered nurses can act as leaders in recognizing system failures, addressing the human factors that can lead to medication errors. So they are talking about medication errors due to human factors, due to human resource like nurses being the medication providers or medication givers to the patient. When medication errors occurs, now the importance of email. What is the main aim? Medication errors occur, immediate steps should be taken. Now understand, they are saying if the medication error happens, when the medication error happens, immediate steps should be taken. Passive voices, B plus third form. Again, importance of passive voices is phenomenal. Immediate steps should be taken by the staff to safeguard, resolve issues. A supportive no blame culture encourages interprofessional dialogue, reflection, problem analysis, and the development of the preventive strategy. The fact of a medication error must be documented. Again, passive voice. Fact of the medication error must be documented. So that is very important in this. And what happened to the client status, all these things are very, very important. So please understand that overall this paragraph is talking about immediate steps should be taken by the staff, medication error must be documented by the staff, and all these things. Agency policy should be followed when responding to documenting the error, and you have to follow this. So overall, if you understand the paragraph, they are giving information to staff, to the nurses, that if there is a medication error, that you should safeguard clients, you should do this, you should do that, medication error must be documented. So the information is beginning. Now I will read the options. Clarify who are responsible for the medication delivery. So ऐसा कुछ नहीं हो रहा, there is no clarification कि medication delivery कौन कर रहा है. Suggest ways to avoid. If you will see the paragraph, they are not saying how to avoid the medication error. They are saying what steps should be taken if medication error happens. Instruct the necessary course of action following a medication inaccuracy. If there is any medication inaccuracy, how can we resolve it? So that is what is this topic all about. Are you guys understanding the point? Is it okay for everyone? Just mention in the chat box if it's okay for everyone, please. Okay, cool. So what it basically means, again, guys, we have done 2 questions in which we have learned the importance of passive voice. Also, we have learned the importance of chief aim questions, overall purpose of the questions. So in these 4 lines were about medication error, but the major lines were about if medication happens, what to do. So number of lines are telling you what is the chief aim of this particular topic. I hope everybody can understand. Is it okay? Can you please mention again in the chat box if everybody is okay with it? Any doubt? Okay, I will unmute you to ask you for any doubt. If there is any doubt, you can ask me, please. I'm just going to unmute you guys, so that because sometimes it becomes, because in when we are recording the session, obviously it becomes a little hard. So I'm just going to unmute you if anybody wants to ask anything. We have done 2 questions, and in these 2 questions we have covered. See, only 2 questions can cover importance of passive voice, is currently being used, importance of adverb, currently, commonly, newest. So many words, newest, recently, all those words have come, currently being used. So ly words have a huge importance to understand where the answer is. Then second important word which is very important is to understand where it is given, and then to find that line and then to do it. And second is purpose wala questions. Last paragraph or the last line majorly will tell you what they are talking about. So I'm holding the recording for now, and will ask you that if you have any doubts. Guys, are you okay with this? Please. You can.
Yes, sir.
Any doubt in these two questions?
No, sir.
Done. Suchi ma'am is fine. Thank you very much, guys. Then rest have said in the chat box, so it seems all good. Thank you very much.